Okay, well, welcome to. So we're talking about a group of muscles called the lateral rotators, and you can see on Mr. Manny here. I've got it painted on Mr. Manny here. They're located on the just on the outside edge between this bone here, which is the top of your femur, and your sacrum, just on that run right there. And if we take the glute muscle, the big butt muscle, and we move it out of the way, you would see these 6 muscles, and they're on both sides, the right and the left. What are some symptoms when these things create problems? Well, we have 6 muscles here, so I don't want to talk about all the symptoms of all 6 muscles. So I'm going to talk about piriformis as just some of the typical symptoms that you might have with this muscle. This muscle has such bizarre symptoms, it's actually kind of difficult to relate it back to the piriformis muscle itself. So let's talk about some of those. You can actually have pain, tingling, or a prickly sensation in the low back, the sacrum, in the buttocks itself, the groin area, down in the legs, even at the bottom of the foot. So we can have that sort of just really bizarre, unexplained symptoms of tingling, pain, prickly feelings. Sometimes people just can't figure out what's causing it. Piriformis is a good cause of that. This can actually be increased with more sitting, and then sitting for a long time, and then being active. That's another way that this will get really upset, get angry and upset. You can also get swelling on the affected side. So if the right side piriformis is involved, you can get swelling down into the foot and the lower leg. You can also have sexual dysfunction with this muscle. Now that's a game changer right there. Most people wouldn't even connect this to, but you can have sexual dysfunction when this muscle is in spasm. For female, it's pain, and in men, it's impotency. So again, a muscle that you wouldn't even think of can cause that kind of impact. There were several studies done that a piriformis muscle that's in spasm, it's tight and just locked down, is the most common cause of musculoskeletal low back pain. So here again, low back pain, and this muscle is not even in the back, it's in your hip. Females are more likely 6-to-1 ratio of female to men being affected by a spasmodic piriformis muscle. Okay, now when we have these muscles that are really tight and the leg is rotated outward in a long-term position, like Charlie Chaplin, right? You're going to start having pain, tightness, and all kinds of issues in the ankle, pain issues in the knee, and the same thing for the hip. So again, we think the muscles are here, the pain should be here, but we can start having problems down in the knee and problems in the ankle because of the way the leg is rotated outward. Okay, and we're trying to use it. So, and I want to talk about trigger points. That's always a big thing for me in massage therapy. So piriformis, depending on the sources that you look at, can either have 2 trigger points or 3. But let's take a look at some of the pain patterns. Just piriformis. This is just the piriformis muscle. So when piriformis has a trigger point, we can have pain right back down here. So just off the side of your tailbone, right in your hip, right here, and then pain. You can get pain all the way down the buttocks, the back of the upper leg, into the calf, and some of the sources, I don't know if you can see that, but I've got it right in here and right down here, and then the bottom of the foot. You can also have pain in the bottom of the foot. The other lateral rotators also can get trigger points. And what we get there, let's see if I can bring him around here, we get a variety of different trigger points here. We can have pain right at what's called the SI joint. That's where your sacrum meets your hip, your sit bone, your tailbone, and your sit bone. So right in this area here where the buttocks comes down and joins the leg, we can have pain there caused by those trigger points. And we can have pain in the middle right in the front of the thigh, right here in the front of the upper leg. Again, that's coming from those trigger points of all the lateral rotators. So that's a considerable amount of pain that you can get, pain patterns that you can get from those trigger points on the 6 lateral rotators. So what causes this? What causes this muscle to get tight? Well, sitting. Sitting tends to tighten up our hips. Hips get tight, the lateral rotators get tight. Men and women drive an equal amount of distances. They're sitting a lot. And if you look at your feet when you're driving your car, more than likely your foot is rotated outward, the knee is resting inward toward the center of the car, and your foot is tilted over a little bit so that the top part of your feet, the pads of your feet, are touching the gas pedal. You don't put your foot square on the gas pedal and push down. Most people rotate it and push with the front of their feet, the top of their feet, by the pads of the toes. And then the left foot, the left leg is not really doing a whole lot of work because we have automatics. So what is the foot doing? It's rotated outward against the door, the side of the door. So we have one leg just dropped over by the side of the door. The other one is leaning more toward the center of the car. Again, that's rotation of the leg. It's outward rotation of the legs. So I think it sets up a pattern, and then it just becomes part of our everyday life. So how do we take care of this? Well, I'm a big fan of awareness. So when you are standing and just talking with somebody, take time to look down and see what your feet are doing. For me, there was two things that got my attention. But one was when I was standing, my right leg was rotated outward. And it was very noticeable, very noticeable. And another good example for me was when I was walking, and we were walking on snow, and I stopped and turned around and looked, and I noticed my feet, both of them, my right was more, were rotated outward. So again, it's a little hard to walk in snow in North Carolina, unless you're in the mountains, but the beach is another great place. Go for a walk on the beach, turn around, take a look at your footprints in the sand. And if you're outward rotated, you will see it really, really plain. Have somebody watch you as you walk and see how your feet are landing. But those are great indications that there's definitely something going on there. Okay, self-care. So getting a softball or a foam ball in there and sitting on and working that glute area, getting that softball in here, and just really working this, get that stuff broken up and loosened up so that you can actually get mobility back in there. Gentle stretching. And let's talk about that when you're using a softball in this area. You want to start slow and easy. You don't want to be aggressive here. Bruising your glute muscle is not going to be a good day for you. So go slow, be gentle. And then stretching is what they call the number 4 stretch, which is you lay on your back, you cross your leg, bring both your knees up towards your chest, take the one leg, I'll say the right one, cross it over so that your right ankle, the outside ankle, is resting on the knee. Take your hand, put it on your ankle, put your other hand on your kneecap, and then pull the whole leg itself to your opposite shoulder. So for me, I have my right leg up. I'm going to pull it gently over to my left shoulder. So again, you're laying on the floor, bring your knees up, cross your leg, put your hands on the ankle, on the knee, and then pull that to the opposite shoulder. Stretching should be done gently. You always want to hold it for the count of 8 to 10, and then release and do 3 or 4 of those stretches. So those are good self-care. If you try that and it doesn't get any better, highly recommend connecting with a physical therapist, a chiropractor, massage therapist. Just get somebody in there that can help you get that those legs back in proper position, and that will save you wear and tear on those hips. Okay, so this is Brian Hagan, the Facebook.